my best friend from the SEAL team, he was my roommate all through SEAL training. I've known him since I was 18 years old. His wife calls me and says, like, he's locked us out of the house. So I go over there and I'm talking to him. He's not on drugs. He's not drunk. Completely matter of fact. He's got his 5-page logic of why it's better for him to be dead. And he's reading it. And here's why. And he's like trying to convince me and sell me on the. I was like, yeah, but none of us want you dead. Like, you got to put that part in there. Think about all of us. Like, we don't want that. All right. Last ditch effort. There's this thing done in Mexico and it might kill you. But if you're going to kill yourself anyway, maybe this saves you.
Probably at that point in time, you're probably responsive to something like that. Say, like this, in this paper, I just met these 2 doctors who one of their patients, but it might work also.
What do we have to lose? And so he's like, okay, he's very private. And he's like, nobody can be there. It's just you and me. So I have to rent out the whole clinic and no one else can come. One night of treatment, he got out of bed the next day. He looked like the 18-year-old boy that I'd met, 30 years before that.
Welcome to Vigorous Podcast. Today I'm joined with Dr. Kirk Parsley. And I'm not so familiar with your work, but I saw some very cool podcasts with you with the Mind Pump and Dr. Gabrielle Leon and Jocko Willink. Yep. So can you tell my audience a little bit about yourself and how you got to be so knowledgeable in this context of neuroplasticity? Okay,
yeah. Well, first of all, thanks for having me on. I always appreciate having a soapbox. I don't have the work ethic to have my own podcast, so I can't stay that scheduled. But yeah, I born and raised in Texas. I was a terrible student my whole life. Like, I was into sports and weightlifting and martial arts and girls and cars, and like I didn't care about school. So dropped out of high school at 17, joined the military. Went to become a Navy SEAL, did that for 6 years. And then, it was well before 9/11. So, we weren't really doing anything but training, traveling different places, doing the same thing. And so I was like, I'm going to go look at, do something else. And didn't really know what I would do, but I thought, maybe like a, strength and conditioning coach, or maybe a physical therapist would be like a stretch goal or something. And I got out and started going to junior college. I had to go to junior college because I didn't have a high school diploma. So I had to go to junior college first. And if you want to go to PT school, you have to have 2,000 hours of volunteer work. So I thought, well, I better get busy on that in case, right? So I started volunteering at a place called San Diego Sports Medicine Center. And it was, PT and a lot of other things, but a physical rehab place. And started volunteering there. They hired me pretty quickly, and I worked all through college there as a PT assistant. And then I figured out pretty early I didn't really want to be a physical therapist. It seemed like just a little too limited. It's kind of like giving people worksheets and doing the same thing over. And I was like, I don't know. But the doctors who I worked with were, because of my time in the military, they were only a couple of years older than me. And so they started trying to talk me into go to medical school. And I was like, wow. I'm like, pump the brakes there, Sparky. Like, I didn't even graduate high school. But yeah, they talked me into at least trying. So like, what's the harm in trying? So I said, okay. So I did well enough to get into medical school. And then when so I'm dating myself, but this pre-internet, you had to go to the bookstore and like look through the Kaplan review books, and it tells you what schools you're competitive, with your GPA and your MCAT and like all that. Like, where do you competitive with? So as I'm flipping through that, I find out the military has their own medical school, and I thought, wow, I didn't know that. And I was already married. I already had a kid. I had another kid on the way. So like, yeah, they're going to pay me to go to medical school or or the other way. Right. So I'm like, okay, I didn't really want to go in the military again, but I was like, okay, I'll do that, and figured I'll get back to the SEAL teams as their doctor, be able to give something back to the community, square that circle, like make everything complete and move on. So
how long, like normal medical school might take 10 years, right? With the residency.
Well, yeah. So medical school itself is 4 years. And then you have to do one more year. It's your first year of residency, sometimes called internship. and you have to have that year of sort of supervised practice to be able to get a medical license. And then you can be like a general practitioner. But if you want to, specialize in anything, an internist is another couple of years. Obviously a surgeon is like 3 to 5 years. Like, so it depends on what you do. And my plan was to go to orthopedic surgery. But in the military, you have to, you after your first year of residency, they make you go out into the regular military and be just like a general practitioner for a couple of years. And then you come back and finish. That's the only way they would have general practitioners. Otherwise, everybody just specializes. And then you don't want to, you don't want to send a surgeon out to a ship to like do, flus and sniffs and stuff. Right. So it doesn't make any sense. Yeah. So you have to break your residency. So I broke my residency. In order to go work with divers, I had to go through dive school, dive medical officer training, which include hyperbarics. And that's a big part of what I do now. But got back to the SEAL teams as their physician. And then ironically, I got there right. The military takes a long time to fund anything. Right. So it takes 10 years to get your money once they agree to something. So they had just received the money to build the very first sports medicine center that the SEALs had ever had, like the very first rehab facility. And built our first gym, and we had we hired the first strength and conditioning coach and the first nutritionist and the first physical therapist. And so we built this place out, and they put me in charge of building that out. And it made perfect sense because that's what I did all through college. Right. So
that's what you're interested in. Right.
Yeah. So I'm like,
that's
all right.
Cool.
I'm like, hey, this is perfect. And so I go in there and we, it takes like a year, first year I'm there, just all we're doing is building out this facility. And it was a great facility, and we hired, people from the Olympic Training Center and from professional sports teams and, Division I university. Like we got really, really good people, to come work for us. And then I was the dumbest guy around, right? Cause now I'm just like this doctor with your 1 year of practice as a doctor. And now I'm just like, so now I'm,
well, that's how you delegate.
Yeah.
Right? Well, you get all the specialists together and you oversee them.
Yeah, well, exactly. When you're in the military, when you're the dumbest guy around, they put you in charge. So they're like, now you're supervising. Like, okay, I'm going to go supervise. So I'm in charge of supervision. And the guys, in SEALs, they're like professional athletes. Like the worst thing you can do to them is put them on the bench. You take them out of their job. They'd rather die. Like really, it's like this is the worst thing. It's like humiliation. You lose your friends. You don't feel valued by the community anymore. It's like, so they don't tell their doctors anything, like, because their doctors can disqualify them. So they just lie. They see their doctor like, yeah, everything's great. Like no problems. You have to do their physical every so often to get checked up. So like, yeah, I'm great, man. No problems. But because I had been a SEAL and because I'd been a SEAL recently enough to where there's still a lot of guys there that I had been a SEAL with, that I'd gone through training with and deployed with and stuff. Right. And so the guys trusted me, and they'd come in my office and be like, hey, let me tell you what's going on with me. Because they're trusting me not to disqualify them from their job, no matter what they tell me. Right. And they're right. Like there's no way I'm disqualifying them. Like, there's no way medical pressure is going to get to me over that community. Right. That's
just going to patch them up and send them back out.
Right. Like we'll figure it out. Right.
Yeah.
So they come in, they start telling me, my concentration is gone. I can't pay attention to anything. My motivation sucks. I'm really moody. Like I'm snapping at my kids and my wife, and I'm like moody at work, and I don't feel like I can remember anything. I walk in a room. I don't know why I'm there. I walk out. I will remember. I walk back in. I forget. I walk back out. And then, and then they're like, my sex drive is down, or maybe my sexual performance is down, and then their body comp is shifting. But even though they're working with the nutritionist, they're doing all the prescribed workouts, they're doing everything you should be doing, and they're getting fatter, and they're losing muscle, and they're getting weaker, and they're getting slower.
Oh my God.
And
all the classic signs of androgen deficiency.
Right.
Basically.
And then they're like, well, but maybe I'm just getting old, doc. And I'm like, yeah, brother, you're 32. Like it's over. It's like, like you're in the peak of your damn life, man. What do you mean you're getting older? And so I honestly didn't know, because I was a Western trained medical physician. Like I knew how to recognize and treat diseases. They didn't have any diseases. Like they just had like this litany of performance complaints. And I didn't categorize it that way then, but I know now.
Which year was this?
This is 2009. 2009.
2009. Okay.
Yeah. And so,
So it's like the beginning of the TRT,
right.
Explosion.
Yeah. And I had actually already been certified in TRT at that point. I'd gone through a couple of different training blocks on that. But I couldn't do it in the military. The military is not going to let me do it. But because I didn't know, I was just like, I don't know. Like, so I just ordered every serum test that I knew how to interpret. It's just like, bam, we're just going to test everything. So that's like the first time I got in trouble because I was ordering like $1,500 lab sets on 400 dudes, right?
But you care about your clients,
right? And then
you care about your clients. That's how you should do it. Just test all, and then you can have all the data to piece it together. I mean, I tell people to do the same thing. Here's like 70 markers.
Yep.
And
it was 98 lab values, 23 vials of blood they would have to go give, right? The 23 tubes. That was the first thing I got in trouble for. Like the Navy hated that. They cracked down on me for that. But and it came back very predictable, like to us, like now, knowing what I know now, and I know what you know, it's like very predictable, right? Every anabolic marker was low, every catabolic marker was high, inflammation was high, oxidation was high, insulin sensitivity was low. They looked like they were 50-year-old, 30-pound overweight pre-diabetic men. Like that's what their labs looked like.
At 30 years old?
At 30 years old. Some of these guys in their mid 20s.
Is that PTSD or lifestyle or what is it, like the root cause?
So I'm embarrassed to say how many guys came in my office and told me their story before this light bulb went off on my head. I was like, one day I'm sitting there and the guy says something about taking Ambien every night. And I was seems like a lot of people say that. So I like make a little note in the margin to, remind myself. And then when he leaves, I go back through my files and every single guy who came in my office has been taking Ambien. And I was like, maybe. But again, I went to a Western medical school. I didn't know anything about sleep. Never had a single class on sleep. I had no idea what happens when you sleep. Right. I didn't know any more than they did. I didn't know any more than my gardener knows. Like I knew nothing about sleep. And I was like, I took pharmacology. So I knew what Ambien was. I knew it was a GABA analog. I didn't know what the hell GABA had to do with sleep, so I didn't really know how that helped, but I knew it was a GABA analog.
Hey, so that's how you learn, right? You find some new compound and then you go down the rabbit hole. Yeah,
so I just started going down the rabbit hole, exactly. And the good thing I had going for me was, the SEALs already had somewhat of a celebrity status. They'd become pretty popular in the media.
After 9/11, right?
Yeah, and so I could call anybody, right? I could see someone's TED Talk, read someone's book, hear someone lecture, hear them on a podcast. I just call them and say, hey, I'm the doctor for the West Coast SEAL teams. I was wondering, could I come train with you? Or could I consult with clients? Could I
leverage?
And every one of them are like, yeah, hell yeah, I'd love to. Love to help. Cool. And every person I called. So I got to learn a lot really, really fast. And once I learned what happens when you sleep, and I learned about the hormone regulations during deep sleep. That's the most anabolic time in your life is during deep sleep. The lowest stress hormones, highest anabolic hormones, all that recovery. I learned about what happens during REM sleep. That's affecting their cognition and their emotions and all this other stuff. And I thought, oh, wow, this, sleep could really be a big problem here. So let me see what Ambien's doing. And, when pharmaceutical companies apply to the FDA, they do the research themselves and they give the FDA what they want to give them, and they don't give them what they don't want to give them.
Tell me about it. That's why research sometimes is so hard, because you go through these clinical trials and then there's a little tagline sponsored by the pharmaceutical company that developed this product. They're like, okay, this is fucking biased then.
It's like, oh, okay. But when they get sued, then they have to give up all the research. And so Ambien, like they were just getting sued for Ambien or all the Z drugs as a category. They were getting sued because it shuts down the neocortex completely. But that doesn't make you asleep. It just makes you not pay attention to your senses. So
and short-term memory is tremendously affected. So I had a lot of American clients that would do bodybuilding competitions on Ambien towards the end, and they forgot they were sleepwalking and eating the kitchen. And they were like, I'm not losing any body fat. Well, you forget that you're eating all the kids' candy.
Yeah,
in the
exactly. You know the story. So like I had patients, or not patients, but I knew people who had taken Ambien. Like I knew this nurse, and she was divorced and our kids were away for the weekend. And she comes downstairs and her whole house is ransacked. And like there's food all over the kitchen, and everything's turned over and it's like a huge mess. And so she runs back upstairs and calls the cops, but she'd taken Ambien and that was her. She was down there like eating all the kids' cupcakes and cooking macaroni and cheese and eating cereal and all this other stuff. But the really bad scenarios is people were, taking Ambien, getting in their cars, driving to the casino, gambling away their life savings, literally like gambling away their mortgages on their houses, picking up prostitutes, because once you get rid of the neocortex, you're down to the lizard brain, right? Feeding, fighting, fornicating, right? Like that's it. Like it's just basal behavior. So that's all you do. And you don't.
Sounds like a good excuse for a wild weekend in Las Vegas. I was high on Ambien. That wasn't me.
And everybody thought it was BS. And then when Ambien, then when they have to, show their data, they knew it. They already knew that happened. The other thing was that Ambien only makes you go to sleep on average 13 minutes faster. You sleep for on average 37 minutes longer, but it reduces REM sleep by 80%. It reduces deep sleep by 20%. And then if you take it with alcohol, which almost every SEAL was, alcohol decreases deep sleep by 80% and REM sleep by 20%. So they had 0 REM and 0 deep sleep when I did their sleep studies. And I thought, this could explain everything. Like I didn't think it would, but I thought this has a potential of affecting almost everything in here. Right. So just getting guys off of sleep drugs. And all I did, like I didn't do anything fancy, like Cochrane database, NIH kind of stuff, just what supplements have been proven to help with sleep. And once you learn, like once you know enough about sleep, it's pretty obvious why that supplement would work. It's like, okay, well that all makes sense. So I put together like a combination of supplements, and because I couldn't just take their Ambien away and say, suck it up. Right. I had to say like, here's something in the place of that.
Right. Some guys have to come off of it, slow and steady.
And some guys have to taper off, right? Like some guys I'd make a serum out of it to where it's like 10 drops with a dose, and then they do that for a week, and then 9, and then 8, and like they'd have to taper on the same time being on these supplements because, they're downregulated their GABA receptors enormously. And it takes, like GABA receptors take anywhere 4 to 8 weeks, depending on the receptor you're talking about, to come back to normal. But when we did that, and then I just did like some light supplementation, with like 7-keto DHEA and pregnenolone and like zinc citrate as a mild anti-aromatase. Sometimes I'd give them an aromatase inhibitor, like just a little bit of like daytime stuff, some adrenal support things. And then their total testosterone tripled, their free testosterone quadrupled. And all of a sudden they go from like being in the lowest 10% of the normal range to the 80, 90th percentile. And there a lot of performance, and it wasn't 100% successful for 100% of the guys, but it was like 80% for 80% of the people. And then later on, I learned, a couple of years into it before I figured out how much brain injury they had. Right. So the traumatic brain injury was a big component as well.
That seems to be a huge problem for guys coming out of the military, the post-traumatic stress disorder and brain trauma in general.
Yeah.
It seems to affect so many physiological processes.
I really think
androgen deficiency.
Yeah, I really think PTSD is is a physiologic problem that leads to psychological issues. Chronic brain inflammation and in some instances just purely damaged brain. So we used to think that you have to like be hit in the head, right, to get a concussion, to get a TBI. Actually, when I was in training in medical school and afterwards, they teach doctors that you have to lose consciousness to have a TBI.
Oh, wow.
So I have a friend from the SEAL teams who he got hit with a frag grenade, and he had grenade material go up through the palate of his mouth and up past his optic nerve, blinded him in one eye, and it's in his brain. But he didn't lose consciousness, so they said he didn't have a TBI. And I was like, he has foreign material in his brain. Like you can't get more traumatic than that. Like that's
no, I know.
Like
did they have to open him up? Did they have to open him up?
It's still in there. It's still in there. But anyway, SEALs have a big suicide problem, and not so much active duty SEALs, but like as soon as people get out, there's a 3 to 5 year window where it's about 5 to 10 times higher than the average population. And they started, like the football players started shooting themselves through the heart to get their brains evaluated. And so this started with this unfortunate, just one young SEAL. I was actually a SEAL with his dad. So I knew his dad, and he suicided. And he had his brain, autopsied and studied. And then they couldn't figure out why they had all these beta amyloid plaques and tau proteins like all over the brain, not in any characteristic pattern of like what you would think of with certain neurological diseases, but the entire brain. And they're like, wow, what's that?
Beta amyloid plaque buildup. Wow.
Yeah. So what they figured out they made a completely transparent skull out of like some sort of plastic, whatever, acrylic that was matched the density of a skull. And then they built a brain inside of it with different materials of different densities that simulate the brain. And then they do a blast wave inside the room with this. And then with high-speed photography, they'd watch the blast wave go through the brain. And they'd watch it. And what happens is, and it's obvious once you see it, it's like, if you've ever seen a video of a blast, you see the wave
shockwave,
and you see everything move, right? And everything moves at a different speed depending on how big and heavy it is, right? And so what was happening is the blast wave would come through the skull, and the dura would move at a different rate than the blood vessels underneath that, which would move at a different rate than the gray matter underneath that, which would move at a different rate than the white matter, which would move at a different rate than the vesicles. So everywhere there was an intersection between different densities, it sheared, and it caused beta amyloid plaque on there. So
it's like boxing then.
Yeah.
Where you just get repetitively hit in the face.
Yes, the entire brain. And so there's just these beta amyloid plaques everywhere, which is, just a marker for inflammation. Like you've damaged your brain. It's like calcification in your joints or calcification in your blood vessels. It just shows inflammation and damage. And so they figured out it only takes about 1.1 Gs of blast force to cause a mild TBI. And it's a very, very mild one, nothing you would notice. But if you're shooting an M4 inside of a concrete room, it's 35 Gs for every bullet you shoot. And you have 3 other guys in the room with you, and they're all shooting, and you're doing this thousands and thousands of times a day for 20 years, right? So it's like, how many guys, at a 50 cal on a Humvee, 65 Gs inside the Humvee for everybody. The anti-tank weapons, the Carl Gustav, 200 Gs for the guy shooting it, 300 Gs for the guy spotting it. So I'm like, all right, well, every single guy I have has brain damage, And so once I started saying, well, that's a component of it too. Now we've gotten a lot better with it. And so I did that, and then I got in a lot of trouble for everything that I was doing for helping him, because I was doing non-traditional stuff that was outside of my scope as a doctor. Like I was giving Myers cocktails.
Really? Okay, the vitamin injections, right?
Yeah. And that was beyond the scope of my practice. I wasn't allowed to do that. I got in trouble for giving aromatase inhibitors. I got in trouble for everything. And so, I was like,
you want to help your patients, right? I mean, you should do no harm, but of course they have medical guidelines, and it seems that they're very easy to throw away your medical license if you do it outside of the norm, which is
right. And the way
troubling because you're ultimately trying to help your patients.
Yeah. And the way the medical world works, it doesn't matter how helpful you are. It matters if the powers that be agree with you. So, I could have, I could treat people with stage 4 cancer and have 100% success rate and still get sued for medical malpractice, because all they do is they pull one gray-haired guy with glasses up there who's a professor at some Ivy League school. He's in his white coat, and they say, did Dr. Parsley follow the guidelines? And nope, he didn't. Okay, that's medical malpractice. You lose your license. It's like, yeah, but I had 100% success. They don't care. Like so I was like, well, I'm not going back into surgery. I'm not going back into the traditional medicine model, because I realized what really excited me was taking people who are already healthy, depending on who you're comparing them to, but like high performing people, and like helping them perform better. Like it's way more exciting to me than handing out pills. And right. And so I was like, well, I want to do that. And so I got out of the military. I opened a brick and mortar that was like a concierge so I could spend 3 or 4 hours with my patients and do that. And then the SEALs kept haranguing me to make a product out of the sleep supplement, like, because they were having to go buy This is pre-Amazon Prime, you know, so they were having to drive around to all the different health food stores and buy powders and liquids and, you know, 90 days here, 30 days here. And like, it was a pain in the ass. And they're just like, can you make us a product? And so I had no interest.
Labeled what was working, right?
Yeah. And I was like, I have no interest in being a supplement salesman, you know, and yeah, I'll look into it. And so anyway, I said, I'll take a year off of practice. I'll just do private consulting over Zoom, like virtual, right? And I'll start the supplement company up, and then I'll go back into private practice. And then that was 10 years ago, and I'm still running the supplement business and still doing virtual practice. So, so it just ended up being my life. And, you know, with the SEALs, we used to have these pre and post retreats. So before they deployed and after they got back, we'd take their whole families out to like a resort and spend 2 or 3 days integrating them, you know, talking about what they're going to experience, about what they're part, giving them resources, and then reintegrating when they're coming back, like, you know, getting the warriors to turn the dial way down, right? Decrease the intensity. And so we would do that, and we'd bring in like people who were there motivated to hear. So New York Times bestsellers and people who were big in the health influence space then, though we didn't call it that. So guys like Rob Wolf and Chris Kresser and, you know, like Dave Grossman came and talked about, you know, the psychology of killing, like those types of things. And then they would always have me lecture because they have me for free. So why not? So I would just talk to the SEALs about sleep and how it affects hormones. Just talk about anabolic hormones, talk about their testosterone, talk about their growth hormone, talk about their estradiol levels, how sleep affects it, body comp. That's enough. So motivated them. They started taking the supplement, but I shared the stage with all these great guys who, you know, were all over the world lecturing and had podcasts and all that. And I was the only one talking about sleep at all in those days. And I was definitely the only guy talking about sleep as a performance tool. And so I just ended up on a lot of podcasts and a lot of lectures. And then I just became the sleep guy, although, you know, that's like 10% of what I do. Like, you know, I do kind of all lifestyle stuff. And then I work with, as we talk about, hormones and peptides and SARMs and SERMs and hyperbarics and psychedelics and freaking
whatever you can deploy for that. Whatever works. Whatever works.
Whatever works. And I don't.
But you usually get typecast that way. Like, I'm known as a steroids guy, but I'm a little bit more one-dimensional than that. But it's just. That's what it turns into, you know.
You get your brand however you get it, and it's hard to get out of it. You know, it's typecasting like actors, right? It's like it's like Arnold Schwarzenegger's the tough guy. Like, you know, you know, like, you don't think of him as a comedic role, but he did that.
He did.
Kindergarten Cop. It was a damn good movie.
Twins, it was fun.
Twins, Twins was awesome, right? But you think, Arnold Schwarzenegger, the Terminator. That's all you think of. Right?
So usually you get known for something, and then you can kind of diversify, right? I mean, you're very well versed in HRT now, and you know, like the psychedelics and the neurotropic agents. So maybe we can switch a little bit to the nootropics and the neurotropic agents, because I think you've used something like Cerebrolysin, Semax, Selank to kind of help people get over these conditions. So maybe we can talk a little bit about that.
Yeah. So I say one of my favorite tools is Hyperbarics. Hyperbarics has a lot of the same releases a lot of the same growth factors and has a lot of the same anti-inflammatory properties as a lot of the peptides, and even the psychedelics have similar things. So if I can get somebody into hyperbarics, and that's an if, because hyperbarics is very time consuming. It's expensive. You know, you got to travel, and a lot of people, and there's not that many of them really. Honestly, access even in America is not great. I have plenty of people that live in major cities, but they're 3 hours away from the nearest hyperbaric chamber. So that's not going to work, because you got to go every day for like 2 months. So they're not going to do that.
And they're expensive. I mean, you can buy them, obviously. Not as easy as you could buy a CPAP machine or an infrared sauna, but you could buy them, but they're expensive. And of course, if you're just starting with a hyperbaric treatment, you don't know how beneficial it is. So you might not want to dish out, $10,000, $20,000 for one of these machines. And of course, if you want a big one, right, where you can actually sit upright, you spend a lot of money. Yeah.
And that's actually one of the projects I'm working on right now, is we have this effort to spread hyperbarics out nationally, because there's lots of interesting research that's already been done and nobody's really put it all together. But I think I use hyperbarics as just a generalized performance tool also. And most people aren't thinking of it like that. So we're doing some work in that area with professional sports teams, and hopefully we're going to make that more accessible. But yeah, so any peptide, almost any immune regulating peptide helps, because almost all brain trauma leads to a chronically inflamed brain. So simple things work, right? BPC 157 and TB 500, like just anti-inflammatory things. Even thymosin can help, right? But then you have things like dihexa. I find that works a lot better is the cream that they put on the back of their neck instead of the capsules.
I didn't know that.
Yeah,
I didn't know that it was a cream of that. So I ran some experiments with dihexa, and I looked into the research, and I saw that it has a huge spike in BDNF, like brain-derived neurotropic factor, although it was only 1 or 2 studies. But I found that with consecutive use, it starts to act a little bit more as a stimulant. So I did not know that. I did not know that. Yeah, cool. So I'm usually pretty sensitive to these nootropics because I'm fully optimized. So after like a week of consecutive use, I'm like pre-wired.
Okay. Yeah. Well, I find dihexa, so it's hard to parse them out, right? So you have all the usual, you have dihexa, you have Semax, you have Selank, you have Cerebrolysin, obviously. There's a lot of overlap to how their mechanisms of actions are considered. And so it's like, which one's working the best? I don't know. So honestly, in the States now, a lot of my protocol is determined by what I have access to, so
and they're all banned now.
Yeah, because they're banning all sorts of things. And even before they banned them, just the compounding pharmacies didn't always have it. There's variation, because the FDA has always been after compounding pharmacies. And so they get cracked down on for this ingredient or that ingredient, and they don't make it, or they're backlogged on it. And so it's a hard thing to do this kind of practice, because most of my time is spent tracking down pharmaceuticals and then making sure that they've been delivered, because the compounding pharmacies just don't communicate that well. So, usually I just always give dihexa, just because I've seen the research and I've seen personal results. I've been using it I guess 5 years now. And I've seen it. I believe it has really good anti-inflammatory effects. I think is the primary benefit. But again, all these nootropic factors are stimulated. Cerebrolysin, though, is my favorite. I mean, that stuff's liquid gold. And I used to do the 10 cc's a day for a 10-day. That was the original protocol of it. Yeah. But now I've moved to infusions for guys. So now they're doing anywhere from 30 to 40 ml for like 4 weeks, Monday through Friday.
But that's the IV one then, right?
Yeah.
The slow drip IV. Yeah.
So small IV, like 100 mLs, but just infused that way. Obviously great, again, I'm not going to drill a hole in people's heads and study their brain chemistry, but the purported benefits of them seem to match what I get.
Amazing. Yeah. So you see people come off of
I see big cognitive enhances really quickly, within the first week of treatment. They notice their cognition, and then by a month, everybody they know is noticing their cognition. So I think that one's great. Obviously, that one does BDNF and also glial cell derived neurotropic factors. It enhances stem cell recruitment in the brain. Hyperbarics does stem cell recruitment in the brain great. So if I can combine hyperbarics and those two, that's great too.
That makes sense. Makes sense to do it, because you get the anti-inflammatory and the growth factors releasing. And if you're going to do an IV anyway over an hour, might as well do that in the hyperbaric, right? I mean, you're not going anywhere. So there's huge synergy to that. I like Selank is mainly an anxiolytic. Although I've just recently, in the last couple of weeks, started experimenting with Bromantane. I was maybe going to ask you if you know much about that, but So I was never able to source Bromantane, and I got a couple samples from a friend of mine to try it. I did like the feeling, but because I can't find, and it seems to be difficult to find, and we can't discuss sources anymore on YouTube, so let's not. Let's not do that. But
I can text you my source, and I don't know if you can get it in Thailand.
Oh, I can if it's international. Don't worry about it. I was never able to get it, and of course I'd like to run some experiments on myself to see what the benefits are, and then I might
Yeah.
do a deep dive on it. So I have access to most of the stuff, and then
Yep.
if I have good results and I see that there's a demand for it, I'll make a deep dive. So I reviewed all the scientific literature for BBC 157. I had all 180 studies, and then I just go down the list of what there's an interest for. But Bromantane, I don't have so much experience with, so please fill me in.
Yeah. Well, I mean, so the reported benefit of it, is that it's a reuptake. It essentially works like a reuptake inhibitor, and whether that's actually doing by reuptake inhibition or slightly improved production, I don't know. I don't think I haven't been convinced either way yet, I should say. But it's working on all the catecholamines, so like it's affecting dopamine, epinephrine, norepinephrine, all in the brain, and serotonin as well. And it seems to have a lot of the same confidence, the anxiolytic benefit or confidence enhancing, whatever you want to call it, kind of the same thing. But just, there's not a whole, like I'm sure you've probably looked into, there's not a whole lot of research on it, but when you read the boards, like the forums, that's honest. I get more information on that basically.
There's
than
a lot of anecdotal evidence. Yeah, a lot of anecdotal.
It gives you an
reports.
idea of like what to go research, right? It gives you an idea of like what to look for now, what mechanisms. And there's always like some PhD on there who's super smart and like,
of course,
gives me a million things to think about. So I got convinced. I got convinced of it. And what most people say is that it enhances their confidence a lot and improves their cognition a bit. And so I don't know. I'm doing it. My wife's doing it. I have like 2 other patients doing it. So I don't know yet. But I think maybe that will replace Selank. I don't know. Selank
could be. I mean, it's a little bit different pathway, of course.
Right.
And again, like if they're banning Selank, Semax, and Dihexa under Article 503, then you just look for the next best thing, just like they do with the WADA prohibited list. They ban drugs. And then I'll look into the literature. It's like, oh, this one is not banned. We'll use that one.
Right. Yeah. It's a constant game of cat and mouse, isn't it?
Exactly.
Yeah. And,
but yeah, it does make sense to suppress that because, of course, purely from like, how you respond to Selank. Bromantane, should be maybe 9-MeBC could have an application with that as well because it helps with dopamine sensitivity.
Yeah. Yeah, so I'll let you know as it comes about. But the Selank, I just think so. I'm usually giving it to people. So again, I do private consulting. People pay me for that. I carry very few patients, and then I still treat any SEAL or any former SEAL who. So I that's my volunteer work. So that's all philanthropic work, but they have to pay for everything. So I try to keep they have to pay for their meds and supplements and stuff. So I try to keep costs down, and I try to find more efficient ways of doing things. But like I said, I just assume all of them have significant brain damage, and so I treat. That's my first thought when they have anxiety problems. My first thought isn't, it's some sort of life circumstance. I mean, they're Navy SEALs. It's pretty unlikely that it's a life circumstance. It's probably more likely a physiologic thing. And so Selank's been my go-to for years, but it just seems like there's a lot of individuality between the dosing, like how much it takes to get.
Yeah, some guys need quite a lot, and some guys respond to very low dosages.
And then good.
Yeah, the problem is with like the ones that you get from Russia, the pharmaceutical Selank. It's nasal drops. It's not a nasal spray that's easy to dose, and they have like two or three concentrations, like 0.3% and 1%, and it makes it very difficult to really adjust the dosage. So what I do like about the U.S. compounding pharmacies or some of the gray area peptide websites is that they just do it in a nasal spray, and then they have Selank or N-acetyl Selank, right, or other variants that have a higher bioavailability. So you can kind of select and experiment and slowly start tapering the dosages upwards. Because, like, personally, I had access to injectable Selank and Semax, and I would prefer,
I started with that actually.
Yeah, so I would do like sub-Q 500 micrograms Semax in the morning, and then later in the day Selank to kind of keep the day going, but also have a little bit of a anxiolytic effect. And I found that for an entire month, I found it super beneficial.
Hmm.
It's yeah.
I did. I was using the compounding pharmacy we were talking about before we got on.
Yeah.
When I first started doing peptides, and I did injectable Selank and Semax. I didn't find anything from Semax. I was like, I can't tell that.
Oh, really? Okay.
I couldn't feel anything from it, but I do have some patients who love it, and I find like I feel like those two combined are great. Like it's a great combination, but if it can only be one or the other, it's literally a flip of the coin. And my patients,
yeah, it's like, what you respond to.
Yeah, basically. It's like which one do you do well with? So I try both. Which one you like is the one we'll keep going with. Yeah,
right. I liked the combination of Semax and DHEA because it seems that Semax has some heightening abilities to neurosteroids, where the neurosteroid sensitivity in the brain is heightened. And I usually fix people's libido with that sense because they have some sort of libido impairment. Then you put them on neurosteroids, DHEA, pregnenolone, add in the Semax, and then later on the oxytocin for the bonding and the heightened arousal. And that seems to work quite well for guys.
I heard one of your clips on Instagram where you were talking about sex hormone binding globulin affecting erectile dysfunction or drive or libido.
But it's in the context of bodybuilders. So okay. I saw your podcast with Mind Pump, right? You talk about free testosterone, and I completely agree with that. Like when your SHBG is high, when you're drug free or on a moderate dose of hormone replacement therapy, SHBG is high and it binds to testosterone, and now part of the testosterone can't really interact with the androgen receptor. Right. What bodybuilders do, we don't take HRT for one, we take HRT for 5 guys. Right. So we're on a gram test. So what you see with a lot of guys, and then Primo and Masteron and all these DHT derivatives, it suppresses SHBG so much that you're missing out on one of the pathways that's the SHBG binds to a complex on the cell membrane, which increases cyclic adenosine monophosphate, which can then interact with the androgen receptor. And without the cyclic adenosine monophosphate, androgen receptor mediated gene transcription is just not optimized. So it kind of kills libido, but it also kills gains.
Wow, that's super fascinating. So it's just if they drive it down like below sort of what a normal range would be.
Yeah, so normal, like on a hormone replacement therapy, you would be usually without Proviron already, or without boron. You'll probably be like 20, 25, maybe 30.
Right. Okay.
And the guys that are a little bit obese and have some lifestyle issues, they might be 40 or 50, still top of the reference range. And then in many cases, either increasing the testosterone or adding in Proviron or boron, that usually fixes it. But then the guys that hammer,
what else drives SHBG really well is ostarine. Like crazy.
Oh, really?
I had no idea. I
hate SARMs.
my wife does.
I thought they're selective.
Yeah, exactly. My wife does very similar work to what I do, but she specializes in women. And she's the one who taught me that, because I've always used a synthetic and not enough for people to get a benefit out of, but like they do the troches, right? Going between your, so like 10 milligrams Monday, Wednesday, Friday of oxandrolone or stanozolol or something like that.
Right.
I do that for a week and I drive their sex hormone, because I see guys come in with a sex hormone binding globulin of 90 and I'm like your free percentage is like 0.5, right? So like you have no free testosterone. So I've always given them the synthetic, which is a really expensive way to go. And then my wife said like, oh, I just give them ostarine. And I was like, really? And like, I'm not a huge SARM fan either.
Yeah. But if it works and it's readily available, it's easier to get them Proviron.
So I started experimenting that over the last year. It's like, damn, that works better than the synthetics. And obviously it's way cheaper. It's like one bottle is like $30 or whatever. And that's all they need, right? For the whole year. Yeah.
True. I just never talk about SARMs because I don't want to empower the SARM goblins.
The SARM goblins.
That's a huge problem in the fitness community where kids, because it used to be pro hormones, right? You used to be able to buy those.
Right. Androstenedione and all that.
Yeah, exactly. And Superdrol and Epistane, and then those are real steroids. Yeah. And of course, a lot of kids fuck them up, and then they come to me for consultations and they fuck themselves up for like 10 years. And then they're desperate and then have to pay an expensive consultation with me to fix them. And I can usually fix them,
Yeah.
So, and I see this with SARMs also, but it's now all the kids that are messing themselves up with SARMs. So I usually stay away from that topic because I don't want to empower these guys
Got you.
to take that stuff, right? But of course, if you do this under guidance for the reason of suppressing your SHBG, I get it. I would still prefer Proviron though, because it has a very high relative binding affinity for the SHBG. But yeah, Austrian could do it all. But then that kind of confirms that Austrian is not selective, right? Because it also binds to the SHBG.
I don't believe anything's selective. You know, it's like once it's in your body, it's like, it's like saying, it's like saying the vaccine stays where you inject it. Like, I'm gonna
empty promises.
I'm gonna look into that Proviron. I've never used that. I've read about it like on the message boards and stuff. And obviously none of my clients are bodybuilders. So we don't, guys don't do super physiologic things, but the foundation of the knowledge is there. So I still read those things, and I can't remember why I was scared off Proviron. Is there some sort of risk with that? Like any sort of complication that's common?
I haven't done a real deep dive on it because it doesn't really have anabolic properties. So I usually throw this drug to the sideline. I mean, it's a DHT derivative, so it's based on DHT testosterone.
Does it have any of the DHT side effects? Does it cause balding?
Well, it can cause some hair loss, obviously, balding, hair loss, acne, that kind of stuff. But if you keep the dose low, usually 6.25 milligrams, so that's a quarter tablet once or twice per day, is already enough to kind of drive SHBG down.
Okay.
And of course, with Austrian, at least you'd get some anabolism out of it. But what I noticed, at least with athletes, bodybuilders, is that Austrian can displace testosterone from the androgen receptor and reduce performance. And there's a lot of anecdotal reports of this. And I noticed this myself when I was running 250 tests and then added in 30 milligrams of Austrian on top. I got weaker. Like, why can't I squat? So it's just displacing the testosterone.
I actually noticed that with every SARM I've ever tried. Like I just do HRT. So I'm like, really low. I do like 120 milligrams a week. I do 40, 43 times a week, like every other day, basically sub-Q. So I'm not like my total test.
You said sub-Q?
Yeah.
Yes. More guys. We need more guys to talk about this.
And so, so I just do that every other day. So I'm not on, like, I'm never super physiologic. But I do notice every time I've added a SARM, I get weaker. My endurance gets worse and I get weaker. And I'm just like, I've always thought it was just some sort of reaction to me. I never really dug into it.
No, it's common. So if you go to some of the, especially Reddit, of course, it's like, the asshole of the internet. Redditors don't cancel me.
It's the Twitter. It's the Twitter of the internet.
Yeah. So people usually go there to complain, right? I have the side effect XYZ. And then you see all these SARM logs of guys experiencing the same thing. And I documented this like a couple of years back. And then I got so many messages on Instagram. Yeah, I got the same thing from Austrian. It's supposed to make you stronger, but it make me weaker. So this was already a huge turnoff for me for the SARMs. So I usually, for the guys that are otherwise drug-free, even if you're drug-free, you can still run Proviron, assuming the dose is kept low enough because it has such a high binding affinity for the SHBG. It doesn't seem to interact with anything else. And it just displaces testosterone. And then free testosterone goes up and you might get some aromatase inhibiting effects, which also preserves some of the testosterone, preventing the conversion into estradiol.
Right.
So that it seems to be quite favorable. And if you dig deep enough, you'll find 40 studies where Proviron improves fertility in subfertile men. But that doesn't mean it's a fertility medication.
Right. Yeah. Interesting.
Yeah, that's a dosages of like 150 milligrams a day. So I wouldn't recommend that.
But that's way too high.
Yeah, it's way too high.
Yeah.
So all these things like usually guys come to me with crushed SHBG because they make it those steroids because it all needs to be transported, right? So your liver can't keep up with SHBG because there's so much influx of androgens and they all need to be transported. And then because SHBG is so low, it's consuming it also because SHBG is so low, you miss out on this, backdoor pathway to the androgen receptor. And then a lot of guys notice that their libido is gone. Because their androgen levels are so high and their estrogen is too low and the androgens don't even function correctly. on the androgen receptor. So if you ever get a bodybuilder with this much problems, then you just take them off the steroids.
Yeah, I was going to ask, is there any way to raise it? I mean, I guess
HCG,
estrogen, like
estrogen,
estrogen, you'd raise it.
Exactly. And so that's what I mentioned in the video. Is that ethanol estradiol or estradiol valerate will increase SHBG, thyroid hormones, at T3, T4. Yeah. And then, of course, you might have to lower the growth hormone, the insulin, the IGF-1, and the DHT derivatives, because those are all terrible for your SHBG.
Yeah.
And then you have selective estrogen receptor modulators. But the problem is, I don't think they're very sustainable. They lower IGF-1, and there's some clotting risk. And like 4 years ago, I wouldn't mind, but now I do mind. Right. In this day and age.
Yeah, I understand that for sure.
So I really don't like Clomid, and I really don't like Nolvadex. And with enclomiphene, those studies have never been performed. The same ones in Clomid, where it shows clotting risk, have not been performed on enclomiphene. So I'm always on the fence, like, is this sustainable or not?
Yeah, I to be fair, I'm glad we're doing this podcast. That's another good tip, another good thing to think about. So I do use enclomiphene for guys.
It's very popular for TRT. Yeah, it's very popular.
Guys that aren't old enough, that don't need TRT yet. They're 35 or 40 or something like that.
Yeah, you just enhance the signal.
Like I can get them up to the high, top 5% of the range with just, enclomiphene, DHEA, aromatase inhibition to whatever degree. Right. And so, but I do usually only use it Monday, Wednesday, Friday, and primarily because I've seen a lot of emotionality with it. Like a lot of guys complain that they get really emotional with it. Clomid was way worse, obviously, but even enclomiphene. So I think with the half-life being so much shorter on enclomiphene, that if you take it right before bed, like maybe it's not affecting them as much.
Yeah, I think that's usually what I recommend the guys also say. Like HRT is like a step-by-step thing. So before shutting down your HPTA, maybe try enclomiphene for a month. See what your testosterone potential is, right? Whether that's 12.5 milligrams 3 times a week or 25 milligrams per day. Right. Experiment a little bit, see what's the most favorable dose, because some guys need more estrogen blockade. And then maybe try HCG monotherapy, which usually increases testosterone levels more than enclomiphene monotherapy. And then you know that your testicles are also not the missing link. Right. And then most guys are like, you know what, I want to see what's behind door number 3, and then they go, with the real TRT.
And my consulting, I give it's a Chinese menu. It's like, here's all the things we can do. Here's the pros and cons of each. You tell me what you want to do. I'm agnostic. I don't care. Like whatever you want to do. Yeah.
In the end, you just want to have a good outcome, right? So I mean, there's multiple ways to do it. And I've recommended HCG monotherapy to guys through consultations like 3 years ago, and they're still doing it. Right. Even though it's a little bit more difficult to source now, and the prices went up. Like, all things considering, they really like it. Of course, in the meantime, they have like 5 kids.
Right. I had
that's so good for fertility.
I had a guy get gynecomastia from HCG.
Yeah, can.
That's scared the hell out of me. That was when I was really young in this practice, so it was 15 years ago or something, and I was using HCG a lot, and then this guy got gynecomastia in like a week, and I was like, Dory had to have surgery.
Oh, that's fast.
Yeah, Dory had to have surgery. So he's super, super sensitive, obviously, but I've always been a little leery of it ever since. But I mean, I use aromatase inhibitors with most guys anyway, because I like to keep estradiol down to, 25-ish.
Yeah, I heard that. 30. What is the reasoning? Because I like to keep it a little bit higher.
Yeah. So, there's always controversial shit and all.
No,
stuff,
I mean, we're having an adult discussion without finger pointing. So I would like to know, because in the bodybuilding space, then you have to, if you keep it too low, you're fight with you.
So for me, I was obviously there's controversy in all the health and wellness stuff, right? Nutrition, like look how controversial that shit is, right? Oh, and so what I've always defaulted to is like, what does it look like evolutionarily, right? So when somebody tells me to be a vegan, I go, okay, ancestrally, were there any vegans? no, like unless they had to be, right? So that I don't believe that, right? And so what I kind of do the same thing with everything. So I try to go back to like the earliest data sets we can find, and there's not much from Framingham, but the Framingham offspring was like in the 70s, and so I try to reapproximate youth in there, right? So a 25-year-old man had a testosterone in somewhere between like 850 and 1150 was kind of like the average in there. Their sex hormone binding globulin was like 10 to 15, maybe 20 top end. And then their estradiol level was again around 25, like 20, 25, something like that. And so I've just been like, I don't know. I've studied under Ruscio. I don't know if you're familiar with him. He's a big hormone guy, and he's always been so anti-aromatases and like, oh, you just let the estradiol and this and that, you're going to cause bone density and joint, whatever, like shit. And then
all the good stuff.
And then 2 years later, a study comes out that says exactly the opposite of what he says. And then 2 years later, a study comes out that says the opposite of that. And it just keeps going back and forth.
Oh, so that's the worst about the medical field. That is that once 10 studies that prove it and 5 that disprove it. And then 5 years later, there's like an overlapping study. It's because of this. And you can't keep up, man.
Right. And unequivocally, what has been patterned out over decades, and most of my clients are older. Like I'm not dealing with young athletes mainly. So most of the SEALs who retire, they're in their 40s. Most of my private clients are 40s, 50s, 60s even. Right. And sustained exposure to estradiol is actually linked heavily with prostate cancer.
Yeah, true. That's true.
I'm like, well, I don't want prostate cancer for
no, right? Especially in older guys. Yeah, that's a very valid point.
And so for me, I'm just like, well, if I keep it at physiologic levels, what I know youth looked like, and even in the 70s, right? We already had industrialization, we already had processed foods and whatever. So things weren't ideal then, but they were a hell of a lot better then than they are now. So I just say, that's kind of the data set going back to like 60s and 70s, where I try to say, what did healthy look like? So, that normal, that reference range for testosterone, the 250 to 1100, that came from Framingham, and the requirements were you had to be 19 or older. You had to be at least 19. You had to have your testicles, and you had to be alive. That was it. And then you were in the normal range. And so, so like when the SEALs would come to me and their total testosterone was, 256, and they're like, well, 250, and I'd send them to endocrinology. The guy's 28 years old. His total testosterone is 256. He's like, it's normal. It's in the normal range.
Yeah, it's within the range. Yeah.
I'm like, no, the 85-year-old in the nursing home had 250. The young dude had 1100,
and if they don't want to change it, they'll just reduce the reference range.
Right.
From 1100 to 820.
And that's what they're doing now. They're just driving the reference range down as society gets sicker. And every 10,000 labs, they redo the reference range. And they're the chair of endocrinology at UCLA, he published a study around 2008 or 2009. And he did it in conjunction with Harvard and Oxford. So, and it was a pretty big trial. And I want to say it was over 10 years, about 30,000 guys. And they didn't, no intervention, it was just observational. And they might have, I think it was even records review and observation combined. But they broke that 250 to 1100 bell curve into quintiles. And so if you're in the upper quintile, so 80% of the range to 100% of the range, if you're in the upper quintile, you had the lowest risk of death and the lowest risk of disease, lowest risk of death from any cause, and the lowest risk of disease. Every quintile you go down, it doubles. So you go to 2, 4, 8, 16 times as high, 16 times as likely to die of any cause, 16 times as likely to have any disease. If you're like under 300 or under 350 or something, like in that lowest part of the range. If that were anything other than testosterone, it would be medical malpractice to not keep that in the upper 20%.
Yeah.
I mean, if that was vitamin D, it'd be like, vitamins,
of course.
You have to do that. But
they'll add it to your table salt.
right, exactly. But because testosterone, is controversial, baseball players use it to hit home runs. So you can't take it. So that's the kind of stuff that blows my mind about medicine. And obviously during COVID, I got even further away from, the traditional medicine, because they just poured themselves out and did all kinds of unscrupulous stuff. And so,
agreed.
It's a messy world now. I don't even like telling people I'm a doctor anymore. Like, I do health stuff.
I mean, it still stands for something, right? It still stands. I think so. Yeah. I mean, I like it. I looked into doing a medical school and residency, but it takes like 5 to 10 years before you're specialized. And I figured, you know what, like I'm 40 years old now. So I figured I'll be done by 50. And I talked about this with Derek, More Plates, More Dates, who's got a big YouTube channel also.
Oh, yeah,
We were talking about should we do get a medical license to shut people up? Because of course we're not medically trained, but we talk about all these medical conditions and how to use hormones in safer practices well beyond what most TRT guys do. So maybe we should get a doctorate degree. Oh, it takes so long. Maybe not.
I tell you, the smartest guys I know, in especially hormone replacement therapy, doctors suck at and the training courses are freaking laughable. Like,
I know.
I went and took these training courses. I knew way more than the instructor the day I got in the class, and that's just from my own self-education. I was just like, this is pathetic. And these guys take a 3-day course and then they go start, in a strip mall and start offering hormone replacement therapy. But the smartest guys I know in the health and wellness space are not doctors. Very rarely.
If they are doctors, they're not trained in endocrinology. They're like orthopedic surgeons or acupuncturists. Like, you can be a doctor in that too. Or a general practitioner. Like, a lot of the guys that I know that are really, really good about hormone replacement therapy, they might be doctors, but then they're specialized in something completely different. But like you, they were interested in hormone replacement therapy and then meal optimization. And you figure it out that way. I mean, everybody has access to the same studies.
Exactly.
You can all access uptodate.com. You can all access examine.com. And you could just do hours of research there and piece it together. And the good thing is, I don't have a medical license to lose, so I can be a little bit...
Right.
I can be a little bit out of the norm.
Well, that's kind of the beauty of what I do too. Is because I'm a medical consultant. When I work with people, they have to have a doctor, because I'm not going to take care of your flu and your broken leg or whatever. Like, that's not me. Like, I do performance, and so, but obviously I do prescribe. So like, I'm basically a health coach that can prescribe. But so I would still lose a broad part of what I do, a big part of what I do, if I lost my license. But
of course.
But I don't feel like I have any control over that. It's like, I'm going to do what's right. And like you're saying, if you're interested, you can educate yourself on it, and then you're honest with your patients. Like, I'm honest with my patients and say, I don't really know this much. It's like, I've been introduced to this peptide or this whatever, and here's what I've studied about it. Here's what I think, and here's why I think it might help you. Do you want to try it? And so I'm not going in there pretending like I know everything. And the number one reason you get sued is because they think you don't care about them, or you've screwed them over and now you're trying to avoid it or something.
True.
So if you actually care for your patients, but to your point, the only benefit of medical school for me at this point in my career, one, it was a language school, right? So it teaches me how to understand studies and research and stuff, right? So I understand the language, but really it's just the credentials that gives people confidence. It's like, he has an MD. I guarantee you know way more about hormone replacement therapy than I do, or like way more about hormones than I do. Like, there's no doubt.
Maybe
you've dealt with all of these different exotic things, and I've
dealt with a lot of them.
I do testosterone and nandrolone. Like, those are my two anabolics. That's it. That's
a lot of scientific literature for those two, though. That's a good thing. I figured about thinking about getting like a doctorate degree, but the time investment is so large that if it takes like 5 to 10 years, and
in 5 years
on YouTube,
in 5 years you're going to be 45, whether you're a doctor or not. So I mean, if you can manage it, right? Because there's there are overseas medical schools. I mean,
if you want credentials, you need real credentials. I mean, I can walk into any school here in Thailand, pay a fee, and become a doctor, but it doesn't mean anything.
Well, I think, I don't know. I would say that might be worth it, because
Dr. Vigorous Steve.
Because people,
what has the world come to?
Nobody asked me where I went to medical school. right?
No,
They
can
just
imagine.
go, "Oh, you're a doctor, okay."
Okay, that's good.
All right,
I
I'll
might have
listen to what you have to say. You're a doctor.
might have to walk into one of these schools then.
Yeah.
Just get
I
it
mean,
done.
it seems like you're doing great anyway, though. So I don't know.
Yeah, it's going well so far. I think
Yeah.
I found my formula. Usually YouTube is a bit of a struggle, right? So
Right.
in the beginning, I didn't really understand the audience, what they would want to see. So I would just make videos that I think are important, right? How to keep your liver healthy, your heart healthy, and that kind of
Right.
stuff. But that at that entry point, people don't care. They want to know how to use dihexa
Right.
and bromantane and
How do I get 24-inch arms? That's all I care about. Tell me,
exactly. Yeah.
Steve.
So I bring them in like that, and then I
Yeah.
try to educate them about health.
Yeah.
And I think it's working.
Yeah.
You know,
You
I
have
think it's
great
working.
content, man. You really do. Like
Thank you.
like not trying to flatter you. Just I was so surprised that I hadn't heard of you when I started watching. I'm like, shit, why have I never seen this guy before?
And because YouTube suppresses me.
Yeah, that doesn't surprise me. Yeah.
Let's shift gears to psychedelics, because I heard you talk about this, in some of the previous podcasts.
Yeah.
And I have fond memories of using psychedelics back in my younger years.
Oh, really?
And, but those were like in the context of enjoyment. And of course, now it's a little bit more commonly accepted to use them for PTSD or for relationship problems or even for neurogenesis.
Yeah.
So like in what kind of context would you like advise them or recommend them to maybe some of your patients?
Yeah. So it's, if you don't mind, I'll tell a little backstory of how we got into this. So, so the whole reason I even knew that these worked with PTSD or brain trauma, or whatever you want to call it. I had a SEAL client, a SEAL patient when I was still at the SEAL teams as a doctor, and he was really dark and he was really angry. He was getting med boarded out, which means they're forcing him out for saying he was medically disqualified. Like the reason people aren't honest with their doctor, right? That I was telling you earlier. So they're forcing him out, and he's super, super angry about it. And he's really big guy. Like I'm 260. He's like 295, 300, 6'5", big man. Yeah. And I'm like, if anybody's going to come murder suicide in my office, this is the guy, right? Like he's just dark, like, look like his eyes are black and just like really angry and pissed off every day. And he'd come in my office and he'd vent every day. And I'm just like, oh man, hopefully it's not today. Hopefully it's not today. And so it took about 6 months for him to get out of the military, and I did what I could to help him. I got him, like I did some hyperbarics with him. I did some hormone stuff on him, and like I was trying to help him. It wasn't helping him a whole lot. But then, he had already been in the military's care for, I don't know, 3 years, 4 years or something like that. Seen all the psychologists, psychiatrists, he was on every medication, all the way up to antipsychotics and like drugs to help him sleep and stimulants to keep him awake. And he was on 17 different medications. And he got out and he just said, I'm not going to die this way. I'm not going to die on these medications. And so he threw he literally, like in the movies, flushed all of his medications down the toilet.
Oh, cold turkey from one day to the next, huh?
And he got on a plane and he flew down to Peru. And he lived in the Amazon with a shaman for reasons I still don't understand, nude, but lived in the jungle for 30 days doing Kundalini yoga, like 6 to 8 hours a day. And then he did ayahuasca every third night. Wow. And then he comes back to the States, and I run into him 6 months since I've seen him last. And he's sitting across this table from me, and we're talking, and I have no idea who he is, which isn't, completely out of line, because I'm the doctor for 3,000 guys. So it's common that it takes me a few minutes to figure out who some people are. But I talked to him for like 25 minutes and I can't figure out who he is. And this dude, like, keep in mind what I told you earlier, he's probably spent 100 hours in my office. Like I've seen this guy multiple hours every day for 6 months. Right. So I have hundreds of hours of talking to this guy, and I can't figure out who he is. And he keeps talking. And finally I'm like, oh my God. He's like, who did you think I was? I was like, I don't know. I still don't believe you're that guy. Like, I had no idea. And everything about him was different. And so I asked him, what is that? Right. And so he told me, and I was like, okay. I just thought that was some BS.
Do you have to be naked?
Yeah. Do you have to be naked? Like, is that, yeah.
Yeah.
But everything else sounds great. So I always thought, there's just some hippy dippy crap, just ways to get high and call it medicine instead of like doing other drugs or whatever. I didn't put much stock into it until that. And I was like, okay, maybe there's something there. And then coincidentally, a few months later, a couple of doctors from Mexico asked me out to lunch, and they tell me about the psychedelic compound Ibogaine, and they have a clinic down in Mexico called Crossroads, and it's super, super successful for opiate addiction. Yeah. And so they're telling me this, like, hey, if you have any guys who have opiate addictions, we can. And I said, well, I don't, like, I'm not even allowed to prescribe opiates to these guys. Like, our guys are disqualified if they're on opiates, so we don't do it. Like maybe post-surgical, their surgeon will give them 5 days worth or something, but like we don't prescribe them. So we don't have that problem. And so it looked like it was gonna be a wash. And then at the end of lunch, they're like, well, it also seems to help with PTSD. And I'm like, oh, okay, now I'm interested. Let's talk about that. And so then I leave. The first thing I do is I go look up this drug. And the first studies I come across is actually 2 news reports of guys dying taking Ibogaine. And the doctors supervising them were the doctors who took me to lunch. And I'm like, well, that's not a ringing endorsement there. I'm not super cool with that. Jesus. And then again, coincidentally, like 6 weeks later, I was already out. I was out of the military when those guys took me to lunch. But I'd just been out a few months. And then about 6 weeks later, my best friend from the SEAL teams, a guy he was my roommate all through SEAL training. I've known him since I was 18 years old. And his wife calls me and says, like, he's suicidal. He's locked us out of the house. So I was like, okay. So I go over there and I'm talking to him, and he's not on drugs. He's not drunk. He's completely matter of fact. He's got his 5-page logic of why it's better for him to be dead, and he's reading it dispassionately and saying, here's why and here's why. And he's like trying to convince me and sell me on the I was like, yeah, but none of us want you dead. Like, you didn't like, you got to put that part in there. think about all of us. Like, we don't want that.
Yeah, exactly.
And so he wasn't going to be moved. And I said, well, all right, last ditch effort. There's this thing done in Mexico and it might kill you. But if you're going to kill yourself anyway, maybe this saves you. And so,
you're probably at that point in time, you're probably responsive to something like that. So like this, in this paper, I just met these 2 doctors who killed one of their patients. Yeah. But it might work also, right?
And so I said, what do we have to lose? And so he's like, okay, but he's very private, and he's like, nobody can be there. It's just you and me, blah, blah, blah. And so I call the clinic, I call the doctor. I'm like, hey, so I have to rent out the whole clinic, and there's a 6-bed facility. No. And like, we have to rent out the whole clinic. No one else can come. But the guy who had been down in the Amazon, I was like, I need this guy to come. And he's another SEAL. So like, come on, let him come.
You have your SEAL's buddy there.
Right. And so he's like, he begrudgingly agrees to it. And then we're waiting outside the train station to pick this guy up and take him down to Mexico with us. He's coming down from LA, and we're in San Diego, and then we're going to go down. And my buddy's got his arms crossed. He's mean mugging in the back. He's like, who's this guy again? And I was like, well, he changed his name. He's in Hollywood. I forget his real name. And so he gets in the car, and I was like, hey, what's your real name again? He says, that is my real name. I changed it. I'm like, whatever, asshole. Do you know what I mean? What was your name before? Yeah. And then he says, well, you know why I changed my name, right? And I said, no. He said, it was a contraction of my swim buddy. So his swim buddy is like his buddy through buds, his roommate through buds. So the same as me and the other guy. Like, all right, yeah. So he's like, it's a contraction of my swim buddy's name. So his first and last name combined is now my new name. Mm-hmm. Well, he did that because his buddy had died in the war. Right. My buddy was with him when he died and repatriated his body. So brought his body back to his family. And so that was mind boggling, right? Like, of all the SEALs, that for those 2 to be in the car for that, I was like, come on, that's not a coincidence, man. That is amazing. Yeah, right. And so then we went down there, and my buddy had been a dark, angry man for years. Like, nobody knew if he had teeth or not, because like he never smiled, right? And one night of treatment, he got out of bed the next day. He looked like the 18-year-old boy that I'd met, 30 years before that. He's like these big blue expressive eyes and smiling and all this facial expression. His voice was different. Everything about him was different. We get back to my house. My wife is standing on the porch when we get home. My driveway's for like probably 100 meters long. And we get out of the car. She starts crying immediately. She's like, "Oh my gosh, what happened? You look 15 years younger." He's like, "I know, I feel great." And then he got one of his buddies who was struggling as much as he was from the SEAL teams. He got him treated, and we got another one treated, and we got another. And then one of the guys that we got treated, he and his wife started a foundation to raise money for that. And now they're doing research with Stanford.
Okay. Good.
And it's all on the up and up, and they have legal protection and all this, and they're and now we have probably 500 or 600 SEALs and former SEALs who've been through the treatment, and nobody really knew at the beginning. None of us knew. We had no idea why it was working. It was just like some kind of voodoo, and it worked.
You did look into like the receptor blockade and
So there was there's a little bit of knowledge about it, but we were like, I don't really know. And so now we've had about 4 years of research. And actually I'm outside of Austin, and the University of Texas is their medical school is doing research on it as well. And so it turns out that all the psychedelics, obviously they're all working through some form of DMT. It's not all they do, but that's a big component of it, the DMT pathways. And what they've shown with functional MRIs is that it decreases the amygdala tone, right? So the whole fight or flight, your hypervigilance component of PTSD, right? So what you're alerted by, what you're afraid of, what's concerning for you, decreases amygdala tone by 90%.
Oh, wow.
You haven't had that since you're like 4 or 5 years old. It's an amazingly low level of sort of stress and vigilance.
Bliss. Yeah.
But of course, also it accelerates all this neuroplasticity, right? BDNF, glial cell derived neurotrophic factor, VEGF, recruit stem cells.
It seems like Ibogaine is like a big brain reset, and you get that. You get that a little bit from Cerebrolysin, but probably not to the extent that Ibogaine can potentially.
Right.
But of course, the treatment can be pretty rough, from what I've heard.
It's brutal, yeah. So I've always, anytime I've learned anything for the SEALs that if it was appropriate, I would do it myself, so I could see if I thought it was snake oil or if it seemed professional enough for our organization, whatever. So I had done I'd done ayahuasca, and it was super, super ritualized, and they had the chicken bones and the gongs and the, whatever, the crystal bowls
vomiting.
And all that. Right. And I thought, man, if this room was full of SEALs, they'd have that guy tied up in the corner, like telling him to shut up and quit banging the gong. And so I was like, that's not going to work. But I hadn't done Ibogaine because my buddy needed it so soon. And so then we got treated him, and then we treated another guy. And so then I was like, all right, no sense of me doing it now because everybody's done it. But I did end up doing it about a year ago, just because they had an open spot, and they said, hey, do you want to come down? And because we have 2 pipelines for that now, and they're like, we have an open spot if you want to come do it, because you've never done it. And it was the most mild for me. I've done psilocybin, ayahuasca, and Ibogaine, but I think I got underdosed. They say like kind of bigger guys, they tend to underdose. So I've seen that a lot with kind of guys. Once you start getting around like 250 and up, like it seems like their formula kind of falls apart.
Really?
Because it's weight adjusted, but it kind of falls apart at that end. It seems like. Right. I know several
guys have
to
be careful because you don't want to overdo it. Just like with what is it? The stuff for surgery.
Yeah. The ketamine.
It's so depressing. Yeah. Ketamine or just real, what is it called?
Well, and
they put you to sleep. It's so depressive that you stop breathing,
Yeah. It can impair respiration, but it's also, especially Ibogaine, but all of them, DMT is a stimulant. And if you have any sort of heart condition, you can have problems with that. But Ibogaine itself is known to cause dysrhythmias, arrhythmias.
All right. Okay.
And so they when you do Ibogaine, you usually have it in a hep lock, so they can give you IV magnesium if you start having arrhythmias.
Okay.
But yeah, so it turns out that, you know, those brain changes, I think the biggest difference, and, you know, and I'm not saying this with certainty, but, you know, where it looks like this is going with the research we've collected anyways, is that, you know, of course, the big benefit is the actual experience, where you lose the ego. Hopefully, right. If you get dosed correctly and you do your sort of heroic journey, you lose the ego, and it allows you to look at yourself more objectively, right? So your ego's not protecting you from seeing the truth, and you can kind of look at yourself objectively and go, well, that's dumb. Like, why am I doing it that way? Like, I've been doing this my whole life. It's a dumb idea. I shouldn't do that anymore. And that's a great experience. And it gives you kind of opportunities to see things that maybe you hadn't thought about. And like, there's work to be done there. But, you know, as soon as you come out of that, if your ego comes back and all your fear comes back, you're not going to want to work on it, right? So that decreased amygdala tone gives you a window of opportunity, right? And you have the enhanced neuroplasticity on top of that. And so I have this enhanced neuroplasticity. So now I can think differently. If I can work out a way to figure out a different way of doing things, I can actually change my behavior because I have the neuroplasticity. I have the fear out of the way to allow me to think through that. And I got shown this pathway during my hallucination, things I needed to work on.
Right.
And then it turns out that the effects of that, you know, they wane over time, but you can have significant effects from the psilocybin for 2 to 3 months after your heroic dose. Then ayahuasca is about 4 to 6 months, and Ibogaine can be 9 months to a year of having that decreased amygdala tone and increased neuroplasticity and those opportunities. So, and like you said, there's like this receptor scrubbing effect, and like it's kind of like a reset of every neurotransmitter with the Ibogaine. Right. So there's other things going on, but I think that's probably the foundational thing. And then, I mean, we had been doing this as a community for 7 or 8 years before I found out that Ibogaine is an amazing anti-inflammatory. And so when people wake up the next day and they have these big bright eyes, what you're seeing is like they don't have any blood vessels in their sclera. So then, you know, the inflammation in the eye bags have gone away. And so their eyes look bigger. And just some SEAL who's no medical training at all. He said that to me. And I was like, what do you mean anti-inflammatory? I started looking into it, like, oh, okay, it is. Right. It's a huge anti-inflammatory. So you're decreasing brain inflammation, increasing neuroplasticity, and then giving yourself the decreased anxiety of the lower sympathetic tone. And then, of course, lower sympathetic tone means lower stress, lower catabolic hormones, like just better lifestyle, lower pain, you know, like whatever. So they amazing benefits with them. And I've had guys do psychedelics, you know, so during their hyperbaric treatment of, you know, 2 months, I've had them do psychedelics in the middle of that and have them on neurotropic.
Is that a disassociating dose where you lose the ego, or is that a micro dose where you?
No. So they're not doing it in the chamber, but I'm just saying during that period, because you take weekends off. So during that period, they'll go do their weekend retreat, like in the middle of that. So you already have a lot of those growth factors and a lot of that neuroplasticity already going, and then you can keep it. Hopefully, you can keep it going. And I've had them on neurotropic. I've only had 2 guys so far, but I've had some guys on neurotropic peptides at the same time of doing all that. I mean, amazing. And that's one of the reasons Cerebrolysin is such a favorite of mine. I did that, you know, with Cerebrolysin and Ibogaine and Hyperbarics, and two SEALs that have done that. And I mean,
probably life-changing.
It is so life-changing. You can't even explain it. I'd sound like a infomercial if I told you.
No, but I can definitely see it because I've done a lot of research in Hyperbaric and Ibogaine I know a little bit about, but I have a lot of experience with Cerebrolysin myself, and it kind of you reprogram yourself, you know?
Right.
And it's very liberating to sort of say. Like I have plenty of experience with psychedelics back in Holland, and I made a lot of breakthrough realizations on what I wanted out of life.
Right.
And of course with Cerebrolysin, you can kind of, you know, reprogram yourself to a certain extent as well.
Right.
And that's usually for the benefit if you can let go of the ego and kind of address the things that need to be addressed.
Yeah.
And then, you know, And
Amazing.
you can't always get it in one treatment, obviously. So you might need to do it consecutively, you know.
Yeah.
But with time, if you're willing to work on it, I think you can make some very positive changes to your life.
Yeah. And what we're doing right now is we're experimenting with guys who are on, who are seeing me. So the foundations that I work with, nonprofits that are treating veterans, specifically working with SEALs, they refer me guys, and then there's word of mouth, and guys call me all the time. So I kind of always have a pipeline of experimental subjects going then. And so one thing we're doing right now, we're looking into continued microdosing. So with psilocybin, and so having them do a psilocybin retreat instead of an Ibogaine, but starting with microdosing and still doing all the other stuff we're doing, and then just seeing like, can we, and a good measure of, it's not perfect by any stretch of the imagination, but a good measure of the sympathetic tone obviously is the HRV. And so you see see a huge shift of that after a psychedelic experience. And so we're trying to see, like, can we quantify like a better, higher durability of the experience if we microdose afterwards. But we don't know yet. It's too early.
There's a good amount of people who prefer microdosing over their antidepressant or over the medications they were on,
Yeah.
And
why wouldn't you do a microdose of something that's improving your brain, instead of like an anxiolytic pill or alcohol or, things that are compromising your health. So if you can get it, like I myself have not had any success with microdosing. I've tried to microdose lots of things, and I think by definition, you're not really supposed to feel much.
No, that's the whole thing. So you use it as an anxiolytic and to kind of relax you and reduce sympathetic drive, and just have like a day off, or maybe continuously days off. Right. Similar to what an SSRI would do, right? It just puts you in a different state of mind. And I use fluvoxamine for about 9 months, 10 months myself to see how it would affect me. And honestly, it was great.
Really?
I really got a lot out of it. Yeah. And you get continuous neurogenesis. I do think that vortioxetine is a little bit more potent when it comes to the neurogenesis. So that's something I might look into. But like, I'm off everything basically to get my wife pregnant. And because I'm such a hypochondriac, I put everything through the fertility analysis.
Yeah.
So I'm like, if there's no tangible evidence that it's good for fertility, then I'm not taking it.
Oh, got
so
you.
That means no fluvoxamine, no testosterone, no, none of the good stuff, basically.
Yeah. So once you slip one past the goalie, then you can get back on your.
Oh yeah. Oh, for first day.
Yeah.
Yeah. We're both 40, so it takes some time, but we probably have to do IUI. So the intrauterine insemination. We've been trying natural for a year now. And it's no luck so far. So we'll probably just do IUI for a couple of rounds and then IVF. And then once I go IVF, then I'll donate a couple more samples. Then I'm right back on testosterone and maybe vortioxetine.
Have you do you know what your wife's omega-3 profile is like?
Can't test for that here, but she does take omega-3 supplements.
She does take it?
Yeah.
Okay.
Yeah.
I was going to say it's a completely anecdotal thing, but both in my practice, whatever. I've been a doctor now for almost 20 years. My wife's been a nurse practitioner for as long. And we both have just experienced that over and over again, that giving women omega-3s, even after they've gone through, they failed IVF, and you get them on omega-3s, and all of a sudden their fertility, like they get pregnant. It's happened to me 3 times. It's happened to her 6 times.
Oh, that's funny. Okay.
It's
crazy. I'll look some more into it. She does take her omega-3s. I take my omega-3s too. And we both take nicotinamide mononucleotide. There was some evidence that might improve fertility parameters. So we're literally doing everything.
Yeah.
That's why it's so annoying. Right? Because I can piece it all together on the scientific literature, but then somehow it doesn't work. So it's been a weird year for us.
Yeah. Yeah.
But it's okay. I'll get her pregnant, and then at one point I'll go right back on the hormone train.
Yeah. Yeah.
My fertility parameters came back just like fantastic.
Really?
Yeah. Like 500 million per ejaculate.
Wow.
And beautiful morphology and motility.
Did you have to do HCG or anything? Or
I'm doing HCG and FSH right now.
Yeah.
Because my pituitary signaling is, after 12 years of like steroid use and abuse, We were talking about, again, TRT for a football team.
Right. Yeah.
That's what testosterone I've used. Yeah, it's the signal is just shut down, but testicular function is still intact.
Oh, good.
So with the right supplements and the right medications, it's my fertility parameters were really good. Just I think it's just age for her, because she's also 40, and the oocyte quality is just a little bit
getting
down.
In that range.
Yeah, so we'll probably do IUI like 2 rounds, and then IVF with the X, where you can actually select the sperm and then inject it.
Right.
So it's going to be another $15,000.
Wow.
Debacle.
Yeah. Well, make sure you don't get demonetized on YouTube. Then
no.
Way if you have to. I don't want to get in the way of your having.
No, don't worry, don't worry. Don't worry. A little bit of self-censorship is doable. Did you ever use MDMA for PTSD?
We have started researching with it. I've done MDMA myself. I did like some MDMA counseling, and we have some SEALs who have done that, but talk therapy doesn't really seem to work in our community that well. So I don't know what to make of that. But we are looking into that. We're trying that. Especially for couples.
Yeah, for couple. I was just going to say, it seems like you put both couples on MDMA maybe once every couple of years, and then you have a good talk session, and a hugging session, and that seems to, to really strengthen the relationship. Yeah, like really enforce, because the relationships get stale right after a couple of years, and then you use the MDMA therapy, right? Of course, to recreational drug use, but it seems to be very, very beneficial for long lasting couples. To kind of keep everything together. And if you have some problems to work with, I mean, you have no filter basically on MDMA. Right. So you get to talk everything out. And if you keep a couple notes, then you can really get those little nagging annoyances out of the way. Yeah. I had an unfortunate experience with that. All right. Tell us about it.
It was a while ago, before I was obviously before I was married, but even before I met my current wife. So it was 6 or 7 years ago. I was in a relationship that was not the right relationship to be in, but we were trying really hard to make it work. And we did that MDMA, but we just did it ourselves. We did it with a counselor, right? And we just did it at the house. And then we had like our all day talk session. And then the next day she was all pissed off about everything I said that day. Like that day, it was great. It was like, oh, thank you for sharing. I love you. Blah. And then the next day she's like, what about him? I was like, oh man, I got suckered into that.
Yeah, too truthful. Yeah. It's too confronting when the high wears off. I can imagine that happening though. Yeah, because I mean, again, you have no filter and you just lovingly talk what you don't like about each other, but also what you like. And of course, when the ego comes back.
Yeah, you just you can't be in you can't be in there with somebody who's got psychological issues, that was the case. There was some dysfunction going on there, which is why we were having to do it, because the relationship was a struggle anyway.
Maybe she already had some serotonin issues, and then you can take the MDMA, whatever serotonin you have left, you up and down, but then you really crash it, and then
oh my god, some guys have kills me. Like I am a zombie for 2 days after doing MDMA. Like it, and so. I've done it maybe 3 times. Like the second time, the next couple of times I did it, we're trying to front load it, taking precursors and stuff to try to maintain our serotonin levels and our dopamine levels, and it's still just crashed. Like I've never had a hangover from drinking alcohol, but I imagine that's what people are talking about. Like I just
the post MDMA depression, and it doesn't matter how much 5-HTP or L-tryptophan or L-tyrosine you take. It just 1 or 2 days. Yeah, and I remember that from the party days back in Holland, because we had the wildest parties. And we take MDMA and whatnot, and then Sunday and Monday is pretty much gone. And then Monday you go begrudgingly, you go to work or school. And you sit there and contemplating the meaning of your existence. And by Tuesday, it's usually okay, right? Yeah. In Holland, I got surrounded by those kinds of people, but you learn through it, and I did a lot of research online about the benefits. So I thought it was a great compound. Yeah. Back then, and I do think it has some therapeutic benefits.
Oh, for sure, for sure. Did you
Yeah.
have you ever used the 5-MeO DMT?
No, no, I never used DMT.
So that's the only. So there's still a stigma around any type
Hmm.
of hallucinogenic, because people think, oh, it's
Not in my
a
audience.
party drug or something, and I'm like, well,
My
you
audience
obviously,
loves this shit.
I'm like, obviously, you've never done Ibogaine, or you wouldn't think that would be a party drug. Because
Yeah.
once you do Ibogaine, you don't ever want to do Ibogaine again. Like I
No,
guarantee
right,
you.
right, right. Yeah.
But the 5-MeO DMT, it's like a complete dissociation of you,
Hmm.
like it's complete ego death, and you have no control. There's no process. It's an explosion. Like
Oh, it's
you
instant, right?
you smoke it. Yeah, you smoke it like a crack pipe. It's a little
Yeah.
crystal, and they're heating it. And like as soon as you lay down and exhale, you're gone. I mean, it's like a rocket out of like off the planet, and you're just like, "Ugh." And so there's no resisting. There's no thinking about it. It's just like you're gone. Like
Yeah.
you turn into light or nothingness or whatever. Complete ego death, and it only lasts like 15 minutes. And then you're totally back down to normal, and you just
Yeah.
feel no hangover effect, anything. So I don't think it's not really that durable. Like you're not going to get a whole lot of long lasting effects. It's
Right.
mainly intellectual. So
Hmm.
that was the first psychedelic I'd ever done. And I did it right before a really busy period where I was doing like 2 weeks in a row where I was just going from like symposium to symposium to symposium and being like
Mm.
on stage, lecturing, talking to
Oh,
people,
wow. Yeah.
working at booths and all this stuff. And I was just revved up. I was anxious. I was, just kind of overwhelmed. And I did that. And then I was just laughing at myself going, oh my God. Yeah. It just puts everything in perspective. You're just like,
Yeah.
oh God, this is so stupid. Like, what am I stressed? Like, oh, and then like the next 2 weeks were great because I was just like,
I can
but it was
imagine.
all
Yeah, what it
intellectual.
takes.
It was all
Yeah.
intellectual. I was just like that. Like I'm like whatever. Like who cares? Who cares if my lecture flops? I don't like whatever. I don't care. It's like been doing them for years. I'll keep doing them. Some of them will suck. That's the way the world goes, right?
That's how it goes, right? Yeah.
Yeah.
Yeah. And
Yeah.
if you feel it sucks, then probably the audience still thought it was absolutely amazing.
Right.
Like they tell you after your lecture, this was like a life-changing, speech. And
Right.
so
Yeah.
So you go through it.
That's always surprising to me when that happens. And people are like, oh, I've something you said on a podcast or I saw or your lecture or your book or whatever. And life train. I'm like, really? Like, I don't,
Yeah, but
I'm not that impressed with anything I've ever said. I'm surprised.
We're our own worst critics, in that
Oh, yeah.
sense. Like you
Yeah,
always think you can do better, and
Yeah.
you want it to be super perfect. But for most people, they usually walk away with a good experience.
Yeah. Yeah.
What about ketamine infusions?
Yeah.
Do
So
you incorporate that? Like I've used ketamine once where I was borderline K-hole.
yeah.
And then I had a bad experience because the disassociation and the sense of time was gone.
Right.
So I wasn't sure if I was breathing. So I spent
Right.
the next 10
Yeah.
minutes wondering if I was breathing or not. So I was really focusing on. That was horrible. Yeah.
I
After that, I didn't want to do it again.
I did that with ayahuasca. I kept monitoring myself to see if I was dead. Like, am I breathing? Am I dead?
Yeah.
Is this death? I don't know. Like, but
Luckily,
that
it goes away with
that lasted
ketamine.
8 hours. I was,
Yeah.
that was 8 hours of that.
Oh my God.
But yeah, ketamine is obviously it's like a synthetic DMT. It's very close molecularly
Yeah.
to DMT. So it has a lot of the same dissociative processes. And on that scale, what I was saying, like the psilocybin, ayahuasca, ibogaine, ketamine is like down closer to DMT as far as like how durable those effects are. I think
Mhm.
because it's synthetic, it probably just gets metabolized into not completely non-useful byproducts. This is my guess. I don't know for sure. Whereas like the other things are being metabolized into things that are probably still beneficial towards the goal.
Right.
But ketamine, I think, is a great introduction because most people, let's face it, most people like have no idea what a psychedelic experience is going to be like, right?
Yeah.
And there's an amazing amount of fear around that uncertainty. And so if you're taking somebody, probably one of the reasons you're doing is because you're struggling emotionally,
Yeah.
cognitively, psychologically. So if you're struggling like that, how much more fear inducing is that to try to say, well, I'm going to make you completely lose your mind for a few hours and in hopes that you come back better. And like, that's not a very appetizing proposition for most people. So like the ketamine IVs, I think, are great because you can just ramp it up and down, and you can start to where people just kind of feel a little weird. They're just like, I don't know, things just don't feel quite normal. And you can go up to like, maybe they're starting to see a little bit of light or feel a little something, and they're comfortable there, and you can ramp them up. Or if they go, oh, this is way too intense, you can just ramp it down and it's gone in a few minutes. And I think it's a good introduction for that, but I don't think
it's a gateway drug.
Right. It's a gateway. Yeah.
Yeah.
In a positive way though. It's a good gateway drug. But I don't think it's as durable as the others, is like the true plant medicines that they're copying.
So I see a lot of people that have good experience with like IV ketamine as a beginner, because again, it metabolizes quite rapidly. So for people without any real experience with psychedelics or these kinds of dissociative drugs,
right,
it might be a good entry into giving that a try. And then maybe that's in combination with EDMR, right? That sometimes works quite well for PTSD. And then later on, if that is unsuccessful, but they do have some experience with it, then yes, you could do the ayahuasca trip or the Ibogaine or a hair's dose of LSD and or psilocybin, right?
Right. And then you have some idea of what you're getting into. And then, also if anybody's going to do a psychedelic, I highly recommend like doing that in a controlled environment. I feel like the, what they call the set and the setting seems to be more important than the drug itself as to what you're going to experience. And so if you're in a dark place, if you're in a place that could possibly be dangerous, just like whatever, you're just not in a nice neighborhood and you're doing it at somebody's house, and like that could sketch you out or something. So if you can work with somebody who's experienced with that, we've all heard the stories of the 60s and 70s, people having LSD trips and then having like flashbacks their whole life. They have this bad LSD trip or something. That's almost completely removed if you're working with people who are experienced, and because they prep, there's some preparation. They tell you, hey, these are the types of things that are going to happen to you, and these are the sort of thoughts you're going to have, and these are the things that are going to make these are the things you're going to be afraid of. Here's how you handle them, and I'm going to be sitting right next to you. So if you need help, you can just like say, "Hey, help me."
A bit of the trip sitter, basically, right? That's what we used to do for psychedelic experience back in the day when it was not for therapeutic purposes. But you have one guy to kind of be the co-driver and to kind of guide you through the experience and make sure that you're on the right mindset. And then for the first couple of times, that really makes a huge difference.
Yeah.
And then you kind of rotate through your friend group, who is going to be the one that is going to be sober and make sure that everybody's comfortable.
Like my biggest fear when like I said, the first thing I did was ayahuasca. My biggest fear was that I was going to lose my mind or something. Like what if I go on a killing rampage or something, or like I run through a glass door? Like I don't know. Like I don't know what to expect. And and I'm looking around the room going, like, who in here is going to stop me? Like if I get raged out, it's like who's going to? There's nobody here going to stop me. So am I safe? And then when we started doing the ceremony, I thought, the shaman and his little group of people, they're going to be here to help us. But then they did the ayahuasca, and I'm like, well, they're high too. Who are they going to help? Like. And so I think that's why I had such a bad experience with ayahuasca, because I didn't feel safe. I just thought, man, this could break bad so quickly, and there's nobody here who can handle it. And I felt like it was my job to be protecting everybody, and I didn't even know what the hell I was doing. I was sitting there afraid.
You can get some like guidance out of that also, right?
Yeah, I mean, and every time I did a psychedelic, that some flavor of that came back in it. It took me a while. I'm dumb, but I'm slow. It took me a while to figure out, I have like huge protective issues, like the superhero complex that I need to protect. Even when I'm doing it in a room full of other Navy SEALs, I'm like, I'm protecting everybody here. It's like I'm the oldest, I'm the dinosaur in the room. Like I'm doing it with guys that are 25, 35 years old.
Right?
Yeah. And I'm just like, no, I got to make sure everybody's okay.
One second. Are you still there?
Yeah.
Yeah. Okay. Sorry about that. Internet connection issues. So yeah, I mean, it can also give you some purpose, right? If you figured it out with a couple trips where you say, I'm always the protector.
Yep. Yep.
Right. It's and sometimes like I said, sometimes it takes a couple sessions before you really get to the root of what's going on. And sometimes it's hard to kind of open up and really let it happen.
Oh, for sure. The surrender is the key. I mean, like there's almost nothing in it if you can't surrender. Yeah. But you think about the population I'm working with. What are the odds they're going to surrender? You know,
no, that's the last thing that they do. Yeah,
yeah. So that's one of the reasons that I think my community uses Ibogaine so much, because I kind of have a little prejudice against it, because I'm like, well, that's the most dangerous one. Like that's the nuclear option of all of these.
It's an end stage for most guys. Yeah,
right. And but my community, it's just that way. It's like, well, their buddy did it, right? So like, well, he did it, so I'm going to do it. Like, I want help. I want what he did, and if he can do it, I can do it, right? And then it's like this. But I think it's probably good because you don't have a choice on Ibogaine, right? Like if you get dosed properly,
same as what I heard from DMT. It just happens, so you got to let go. With mushrooms or LSD, you can kind of dose it until you say like, "Fuck it, I'm going to go to the full 10 grams." Right. With with mushrooms, and then in the beginning it's like, this is pretty cool, and then after a while it gets too overwhelming, and then you just got to say, "Okay, fuck it."
Yep.
Whatever happens.
And it's when you go, okay. Like that's when all the breakthrough happens. Like, all right,
you melt to the couch, and then the good stuff will happen, But letting go, that's the hardest part. For a lot of guys.
Yep, for sure.
Good stuff. Hey, this was very insightful.
Yeah,
it was a lot of fun. Where can people find you?
Doc, so DOC, short for doctor. Doc Parsley, like the herb. DocParsley.com. Mm-hmm. That has all my social on it. I honestly don't know my social that well. It's like some of it's at Kirk Parsley, some of it's at Doc Parsley.
I'll link it down below.
Yeah. Okay.
I'll link it down below.
Yeah. Well, cool. Well, thanks for having me on, man. I really enjoyed it, and I'm going to keep following your work. I like what you do and say, and if you ever want to talk to me again about anything, I'm always available.
Likewise, I'll let you know. I'll follow your podcast, and I'd love to have you on again.
Okay,
especially if some more breakthrough stuff I share with my audience, that would be absolutely great. Thanks so much, man. Have a good day, and I'll talk to you soon.
All right. You too. Thank you.